Hi everybody, Diane McCracken here. In this third video, I wanted to explain a little bit about how craniocervical instability occurs. In many cases, it occurs because of a whiplash. And this is how mine happened. What happens is that a person has a whiplash injury, and oftentimes, after a few months, they recover and think that they're fine. But what actually has happened is that the ligaments have sustained an injury that doesn't go away. It's just very mild at the beginning, and that over time, with use of the ligaments, which are constantly being used because our heads are almost always in motion, the ligaments actually become more and more damaged, and within a few years, the person actually starts to experience symptoms. And these symptoms often seem to be completely unrelated to the car accident and often don't really seem to be related to the neck at all, as they often occur in the head. Another way that craniocervical instability can occur, and this is one of the more common ways, is through a connective tissue disorder. One of the most common ones of these is called Ehlers-Danlos, or EDS. Ehlers-Danlos, or EDS, is part of a spectrum of connective tissue disorders, and it is becoming more apparent over time that this spectrum disorder is grossly underdiagnosed, and that a whole range of conditions and syndromes are actually caused by underlying connective tissue problems. In the case of a connective tissue disorder, what happens is that ligaments are a type of connective tissue, and the joints tend to be lax throughout much of the body of people with these types of conditions, and in particular when the ligaments of the neck and especially the upper neck become lax to a certain point, then the head no longer is stable on the neck, and this is another common cause of CCI. A third cause, which may be related to connective tissue disorders, is brought on by some kind of systemic problem, such as a virus. For example, one of the most famous patients of CCI is Jennifer Brea, who did the documentary Unrest, and hers seems initially to have been brought on by a viral infection. And this is commonly enough known. A lot of people start out with a viral infection and suddenly develop what is called chronic fatigue syndrome, CFS, or ME. And as I mentioned in an earlier video, in a number of cases, probably more than we realize, these people are actually suffering from craniocervical instability. This has to do with the fact that systemic problems often create a significant amount of mast cell activity, which can do a lot of damage to connective tissue. And again, when the ligaments at the top of the neck are the connective tissue that are damaged, or at least part of the damage done, and oftentimes there are significant comorbidities with this. But when enough damage is done to the ligaments at the top of the neck, the person develops craniocervical instability. So it might be worth your thinking about people that you know in your life who have been diagnosed with chronic fatigue or ME, and are finding it harder and harder to be upright, and are developing some of the symptoms, which I will talk about in a future video, because they may actually have craniocervical instability.